Hello and welcome. Today, we're diving deep into a condition that affects a surprisingly sensitive area, seborrheic dermatitis of the ear canal. Many people associate seborrheic dermatitis with the scalp or face, but it can indeed manifest in the ears, causing discomfort and irritation. Join us as we explore the causes, symptoms, and management of this often overlooked condition. So, what exactly causes seborrheic dermatitis in the ear canal? The exact cause remains a bit of a mystery, but experts believe it's a combination of factors. One key player is the Malassezia yeast, a common fungus that naturally lives on our skin. In some individuals, this yeast can trigger an inflammatory response, leading to the symptoms we associate with seborrheic dermatitis. Genetics also play a role, making some people more predisposed to developing the condition. Other contributing factors include stress, hormonal changes, and even certain neurological conditions like Parkinson's disease. Let's break down the pathophysiology, or how the disease develops. It all starts with an overgrowth of Malassezia yeast. This overgrowth disrupts the skin's natural barrier function, leading to inflammation. The body's immune system then kicks in, further fueling the inflammatory response. This results in the characteristic redness, scaling, and itching that defines seborrheic dermatitis. In the ear canal, this inflammation specifically affects the skin lining the ear, leading to discomfort and potential complications if left untreated. Understanding how common seborrheic dermatitis of the ear canal is can be tricky, as it often goes undiagnosed or is misdiagnosed as something else, like eczema or psoriasis. However, seborrheic dermatitis in general is quite common, affecting a significant portion of the population. It tends to be more prevalent in infants and adults between the ages of 30 and 60. While specific statistics for ear canal involvement are limited, it's safe to say that it's a relatively common occurrence, particularly in individuals who already have seborrheic dermatitis elsewhere on their body. The symptoms of seborrheic dermatitis of the ear canal can range from mild to quite bothersome. Common signs include persistent itching inside the ear, flaking or scaling skin that may appear white or yellowish, redness and inflammation of the ear canal lining, and a feeling of fullness or blockage in the ear. In some cases, there might even be a mild discharge. Because the ear canal is delicate, even minor irritation can lead to significant discomfort. Diagnosis typically involves a thorough examination by a healthcare professional, such as a doctor or audiologist. They'll carefully inspect the ear canal using an otoscope, a specialized instrument that allows them to visualize the area. They'll look for the characteristic signs of seborrheic dermatitis, such as redness, scaling, and inflammation. In some cases, they may take a sample of the skin for further testing to rule out other conditions, like fungal infections or psoriasis. While seborrheic dermatitis itself isn't typically classified into distinct types, its severity can vary considerably from person to person. Some individuals experience mild, intermittent symptoms, while others have more persistent and severe outbreaks. The extent of inflammation and the amount of scaling can also differ. This variability often influences the treatment approach. Managing seborrheic dermatitis of the ear canal often involves a combination of strategies aimed at reducing inflammation and controlling the Malassezia yeast. Topical antifungal medications, such as ketoconazole or miconazole creams, are commonly prescribed to target the yeast. Topical corticosteroids, in low potency and with caution due to the delicate nature of the ear canal skin, can help reduce inflammation and itching. It's crucial to follow your doctor's instructions carefully when using these medications. Gentle cleansing of the ear canal with a soft cloth can also help remove scales and debris. Avoid harsh soaps or scratching, as these can further irritate the skin. Unfortunately, there's no guaranteed way to prevent seborrheic dermatitis of the ear canal completely, especially if you're genetically predisposed. However, there are steps you can take to minimize flare-ups. Manage stress levels through relaxation techniques or exercise. Avoid using harsh soaps or chemicals in the ear canal. If you're prone to seborrheic dermatitis, talk to your doctor about preventative measures, such as using antifungal shampoos or creams on other affected areas of the body. The prognosis for seborrheic dermatitis of the ear canal is generally good with appropriate management. While it's often a chronic condition, meaning it can come and go, most people can effectively control their symptoms with medication and lifestyle adjustments. Recent research is focusing on developing more targeted therapies to address the underlying causes of seborrheic dermatitis, including new antifungal agents and approaches to modulate the immune response. As we learn more about the condition, we can expect even more effective treatments to become available in the future.